To sing and to grow into healthy and productive adults, children need healthy lungs. But everywhere we look in our big cities, it seems that their lungs are under constant threat from toxic fumes and air pollution. We know that this is bad for them, but still have much to learn about how bad. And if it makes a difference if you live in a planned neighborhood or a slum. To try and find out, Dr. Helen Meme from the Kenya Medical Research Institute teamed up with Nairobi residents from the informal settlement of Mukuru and the neighborhood of Buruburu to set up the TUPUMUE Lung Health Research Project. I am Peri Saleh. I live in Nairobi, Kenya, and I am a TUPUMUE Lung Health Champion. In this film, I'll show you how the research was done and what the main outcomes are. But first, some background about the two areas involved in the study, Buruburu and Mukuru. Buruburu is a busy and vibrant residential area, planned and built in 5 phases in the 1970s and 80s. It has a modern services and facility, a decent road network with good connections, and many quiet streets and compounds. The neighborhood's inhabitants are mainly middle-income professionals and business people. Mukuru is a large informal settlement, or slum, on Westland along the Gong River, close to the industrial zone of the city. This sprawling area is densely populated, but most roads and streets are unmade and often double up as drains. The buildings are mostly makeshift structures, and many people have to rely on communal taps and toilets and improvised electricity supplies. Together with the residents from these two areas, the project designed a scientific way of comparing the daily levels of air pollution the children are exposed to in the two very different parts of the city, and if and how it affects the development and performance of their lungs. In partnership with the Liverpool School of Tropical Medicine, an international team of scientists were brought together with expertise in lung health, air pollution monitoring, research methodology, social sciences, and creative ways of engaging people in research called sensitization.
We have formed a very strong sense of teamwork, and we are here also to engage the stakeholders, because the child, being who they are, have a lot of interested parties. And therefore, for us to work out the study procedures, we felt we need to work them out with the involvement of all these other stakeholders.
On what day?
We've gathered a lot of information, and the honors now, the way forward is to put that information together in form of protocols that should go through the approval processes, and we are good to go.
Staff training, community sensitization, recruitment and data collection for the study took place between November 2019 and December 2021, with a 14-month pause in the middle because of the COVID-19 pandemic. The outcomes were worth waiting for. The main results shows an average level of air pollution of 40 in Mukuru, which is 80% higher than the average level of 22 in Buruburu. In both areas, the level of air pollution is well above the World Health Organization's recommended safe level of 15 micrograms per cubic meter. And levels of air pollution in the schools are much lower than in people's homes. Works that were done with participants in Mukuru passed through more areas with high outdoor air pollution than works in Buruburu. The lung function of children in schools in Mukuru is no different from that of children in schools in Buruburu. But they do have more wheezing symptoms, more trouble with their breathing, and more lung infections in Mukuru than in Buruburu. These symptoms also appear to be more severe in Mukuru, resulting in more clinic visits and days off school because of breathing problems. In both areas, children with symptoms of asthma have often not been diagnosed with asthma. And in Mukuru, breathing problems and asthma are even less often diagnosed and treated than in Buruburu. We know from a lot of previous research around the world that this pattern of findings will over time almost certainly lead to worse lung function and lung disease in adulthood, particularly in Mukuru.
Although we did not find differences in the lung function testing that we applied to children, we did find that wheeze and difficulty in breathing, which are signs of asthma, are a problem in both communities and actually more common in the informal settlement. One of the things that can be done is to diagnose and treat all these children who have been found in our study to have, signs of asthma. And the reason we propose this is because in other studies it's been shown that children who have, asthma during childhood and it's not diagnosed and managed properly progress to have lung problems way into their adult life. So that is one thing that could be done in the short term.
As a government, we need to really ensure that we improve access to healthcare in those settlements by maybe upgrading the facilities to the level that can have the capacity to diagnose and treat asthma, especially in children.
Our result findings are indeed very important because our study is the first study to study non-communicable lung diseases in school-going children and comparing results in two different setups. In addition to this, we feel that these studies speak to a larger population, considering that 350 to 500 million children globally live in informal settlements.
So, how was this study set up and conducted to make sure that these outcomes can be taken seriously? First of all, in what is called a co-created citizen science approach, community participants were involved in all stages of the research, from study design, methods and sensitization, right through to data collection and sharing of the results. This made sure that the study's objectives were relevant to the community's questions and concerns.
Buruburu is one of the areas that is concerned about the pollution. One of them being the public vehicles which passes through here. This road here is called Mumia South Road. The public vehicles you find around here emit a lot of fumes, and people don't understand why sometimes they keep on coughing. These vehicles, the engine is running. Instead of even of switching the engine off, they leave them running and the children are inhaling the fumes.
So we have so many challenges in Mukuru, Kayaba. One is pollution. The community is surrounded by the factories, the industries. Now the industries, there is panning of waste are poorly done because of poor planning. So the people who are staying there, they really suffer. Now with this kind of the study, we are going to understand about pollution. Pollution directly starts from the house because we normally use stoves and other cooking items, whereby pollution starts straight from the house.
The views of the community were also important in avoiding many practical problems in conducting the research. For instance, by helping decide what type of available equipment will be best suited to measure the air pollution the children are exposed to at home, at school, and outside.
We have instruments that are used to measure air pollution. So we have two types. So we were trying to look on which is the best instrument to be used and how it can be used and when it can be used and who will use it.
We've been able to go through it and actually come to agreements on how best we feel this can be done.
And community involvement from the start also helps greatly with recruiting the large numbers of 5 to 18-year-old children and their parents needed to get reliable results. The recruitment targets for the agreed study design were 2,000 children and parents for health questionnaire, spirometry, and 6-minute run, 200 households for air quality monitoring, 120 children for qualitative research, and 40 teenagers with breathing problems for walking interviews. In November 2019, the study design and protocol had been approved. At KEMRI, training workshops were held with international experts so that the study's field workers from both communities could familiarize themselves with the gadgets used and with the process of collecting reliable air quality measurements and accurate lung function data.
Right now we are doing calibration linearity check before we embark to doing calibrating the spirometer machine itself. And also, we've learned a couple of things in the morning about the things you need to know before you start doing any spirometer test to any child. This training has really encouraged us and tried to increase our skill. So when we go to the field, there's just a little bit of combat from what we had previously. So we are a little bit confident right now and good to go.
The training workshops were a mixture of classroom learning and hands-on practical pilot sessions in schools and homes.
Today we are doing a short test run on how the study will be on the actual date. It was theory and it was not making sense. I was finding it a little bit hard. It was not getting, but once we did the test run, it's now very clear and it's now practical.
So all you wait knows our location.
Employing and training field workers for the study from the local communities also helped to build capacity for future follow-up research and other projects.
It's MOD on the beat.
Building on their involvement with the design of the study, members of both communities came together in December 2019 and February 2020 with Kenyan and UK artists and researchers to create the TUPUMUE sensitization strategy. The purpose of the sensitization was to raise awareness of lung health and air pollution problems and to encourage children, young people, and parents from both areas to take part in the research.
Like this. So like this.
27 local people were recruited, trained, and employed as lung health champions to organize and manage the different creative sensitization activities.
Mimi ni one of the champions wa TUPUMUE. Yes. TUPUMUE ni organization organized by the UK government na Kenyan government ili kuchunguza the lungs problem and to see whether Buruburu and Mukuru wanapumua the same. Yeah.
Many different approaches were used in the campaign. Local artists were coached in how to use visual arts and graffiti sessions to engage children and teenagers in the project.
In doing, you're reinforcing learning. You're also creating memorable experiences, which the students, the children involved in it will remember that what they did. They'll remember it was about lung health. They'll remember its reinforcing aspects of the study. Doing visual art involves different materials. That's not always available. So also there's novelty in the act as well.
Some traditional children's games and pastimes were changed into tools to help children understand the reasons for the research. For example, Blind Striker became all about kicking out lung disease by listening to the right information. A puppet play was created to show children what would happen if they decided to take part in the study.
Billy's Day Out, which is the show around sensitization with the two puppets, is targeted towards schools mainly, because the messages are very clear. It's also a lot of reinforcement through repetition, so call and response or asking the audience questions.
GPS!
I'm not working with school children. My job here is to train the trainer, basically. I'm working with the TUPUMUE champions to get the pieces ready and developed, and then have the champions from both Buruburu and Mukuru to go out to their schools and perform these pieces.
Some champions, including me, formed the TUPUMUE music crew, who wrote a special song and made a music video which was widely shared.
Kasubui nafanya tizi, nakula fiti na ishi fiti. Mtaani watu wanijua vifiti, kila nikipita wanadai 50. Lunga na Rube, ishi fiti. Yande na Njenga, ishi fiti. Mukuru Tuburu, ishi fiti. Pumua fiti, ishi fiti.
The song is called Tupumue, Wake Up Call.
And big neighborhood parades were held in both Buruburu and Mukuru to capture people's attention with banners, placards, speeches, games, song, dance, and quizzes. The sensitization was effective. 27 local people were recruited as lung health champions, and a total of 2,403 children and their parents took part in the study. Sensitization, recruitment, and data collection all started in January 2020. Then, in mid-March, everything stopped because of the coronavirus pandemic.
On the 16th of March, we were informed that because 3 cases of COVID were identified in Kenya, that all research has been shut down. Everybody is staying at home and self-isolating. So the consequences of this are that we may not be able to recruit any children for the rest of the year, and we're going to have to wait to do the air quality monitoring.
The study was paused until restrictions were eased in April 2021. To try and keep people aware of Tupumue during this 14-month pause, sensitization was carried on. A special coronavirus version of the Pumua Fiti music video was released, and a COVID-adapted video of Billy's Days Out puppet play was made available to use online instead of live performances. In April 2021, sensitization continued, with large-scale murals near local schools and COVID-safe classroom sessions. From July 2021, COVID-safe enrollment and data collection also continued. As before, many primary and secondary schools in both areas played a vital role in recruiting participants for the study.
We are going to marshal our parents so that data collection becomes very easy for the success of the research. I hope we are going to be of a lot of benefit to this program.
Researchers spoke to children in class about taking part, and parents were asked at regular school meetings and parent evenings. Parents were then invited to come to the school on a certain day to give informed consent and to complete the study questionnaire about their child's health history.
They are given an information sheet where it entails the details about the study. The parents read the information sheet. They are given a room to ask any question. After that, we give them forms whereby they fill, they consent, they are willing to participate in the study. They consent that their children to be part of the project. After that, they are asked about the children's early life, they are healthy, whereby the parent is asked to give information about the child during 1 year up to the past 1 year.
They were also asked to bring the child's health card with them, which was photographed so that early life health data recorded on it, such as birth weight, growth chart, and childhood chest infections, could be used in the study. This way, parental consent, child assent, and early life health information were obtained for a total of 2,403 children, 1,107 in Buruburu and 1,296 in Mukuru. At 11 schools, 6 in Mukuru and 5 in Buruburu, participating children had their lung function measured through a blowing test called spirometry, before and after a 6-minute run.
We are moving from one school to another into selected areas in Mukuru and Buruburu areas. We have our laptop and the spirometry itself. The main thing is just to measure the volume of air. You take a deep breath, then you blow out fast and hard as possible for a period of 6 seconds. Then the participant is subjected to a 6-minute run, whereby that is to increase the heart rate. Then the participant is supposed to blow 3 acceptable blows at 0, 5, and 10 minutes.
Since COVID, an extra viral filter was added to the spirometer to help reduce the risk of spreading the virus. Suitable medication and support were available for any children that needed it. A total of 1,599 children did the spirometry test and completed the 6-minute run, 737 in Buruburu and 862 in Mukuru. Field workers measured the air quality in the homes of nearly 100 children in each area for 24 hours by installing a purple air gadget in the home, which measures small particles of air pollution.
Alaska.
They also asked the child to wear a Alaska device on their arm while in the house to measure carbon monoxide from burning fuels. The households for air quality monitoring were carefully selected to be representative of the total group of participants in gender, age, school, household smoking, and fuel use and way of traveling to school.
When she's at home, this is how she will wear it. If she goes outside, she will leave it near the car.
This way, air quality was measured in 179 households, 88 in Buruburu and 91 in Mukuru. Air quality was also monitored at 5 schools in each area, as well as at 20 popular meeting places for children in Buruburu and 21 in Mukuru. To get a better understanding of their real-life experience, children of both communities were asked to make story drawings about lung health and air pollution.
We wanted to get the perspective of the children in terms of what was the understanding, how do they understand about lung health or air pollution in general in the community. We gave them the 15 minutes to 20 minutes allowed time for them to draw. Then after again, we asked for volunteers who would explain to us about their drawings, what they have drawn.
Their drawings were then analyzed in terms of themes, images, and location.
In quantitative, we were actually measuring the quality of air of where the participant actually stays. Now with qualitative, we could know why we have that number.
In total, 506 children took part in the story drawing sessions, 283 in Buruburu and 223 in Mukuru. In both areas, older children with wheezing symptoms were invited for a walking interview, taking the researchers from a location where they felt breathing was more difficult to a place where they could breathe easier.
So today we had a walking interview where we interview participants who are aged 15 to 18 years old. What we normally do is that we meet the students either in school or at home as we ask them some basic questions, for example, demographic questions. We ask them questions about lung health. We ask them questions about the true location, that is a place where they experience difficulty in breathing and the place where they find it easy to breathe. We also ask them questions about air pollution.
The research team measured the air quality during the walk with a purple air gadget, gathered GPS location info, and recorded the conversation on a GoPro camera and a sound recorder. These records were then analyzed to get information about air pollution hotspots along the routes and the child's experience of them.
So the students, the participants are, they are easy. They can tell us to pass a question, to repeat a question. So we make sure they understand the question, and then we flow with their pace.
A total of 45 walking interviews were done, 20 in Buruburu and 25 in Mukuru. During the data collection period, the TUPUMUE project manager kept close control of the work of the field workers and the project team to ensure that the agreed research protocols were followed and high-quality data were collected.
I wouldn't have a normal routine day that I'd go to the office, sit down, take a pen, and then do something routine. At one point in the day, I would be in the field doing sensitization of parents, or I will be in another station doing sensitization of teachers. Different things were done on different days, and different activities were done at different times. Children will be recruited in the morning, exposure measurements will be done in the evening. So it was actually a very, very unique study that I've seen.
When data collection was complete in December 2021, all the information was put onto the Cambridge computers and then checked, cleaned, and analyzed. Throughout the project, The KEMRI research team kept in close contact with their international expert partners through regular video meetings.
People slot, so
this way, progress was monitored, problems solved, outcomes tested and discussed, and support given where needed.
We really got a lot of support, and I would really commend the kind of communication structure that was actually made by our team here.
Brilliant. So thanks very much, and we'll see you all again in September.
The results of the study were shared with the participating communities in several different ways. Through film screenings, public meetings, comic books for children, and in briefings with officials and policymakers.
Considering that initially we involved the community, all the stakeholders in the design and the conduct of this study, we feel we have a duty to go back to the same stakeholders and discuss our results with them. We plan to go with these results to the schools, share the results with the schools, and get their views on what they think the interventions or the mitigating factors could be. And once we discuss our results with them, then we shall have or come up with homegrown interventions from the schools that participated in the study, from the participants themselves. Then we get the feel of what we should do to mitigate these problems that we have. And then, of course, then we extend this further and involve the communities themselves that we sensitize so well. Because, again, we feel sharing these results is a way of sort of educating people in the community, like the community health volunteers, on the signs, on the symptoms of asthma. And that actually it will also be a forum where we will be able to help in destigmatizing asthma by educating the public that asthma is not a disease that can be, passed on from one person to the other through being in contact.
And of course, articles were published in several Kenyan and international scientific journals. Several follow-up studies are being planned to uncover more and more facts about who we are, what we do, and where we live affects the health of our lungs and our ability to breathe.